Menopause is a stage when women's ovaries function is gradually declines. Usually that happens at the age of 45 or to 55. And in Hong Kong, the average age of women going through menopause is around 51. And there's some situation when women can experience menopause earlier than usual. Most happen in those people who had previous surgery to their ovaries, or if they have undergone some medical treatments such as chemotherapy or radiotherapy to their ovaries. So the common symptoms of menopause include usually a change in women's menstruation cycle. For example, there's an irregularity in their period. Other common symptoms of menopause include hot flushes, some dryness in the vaginal area, or discomfort during sexual intercourse. Other physical symptoms include pain in the joints or change in their metabolism, which lead to an increase in their weight. So menopause can cause some psychological symptoms such as anxiety, and some women can experience some mood swinging and also brain fogs. Menopause is a clinical diagnosis, so if the women are within the range of 45 to 55 and they experience change in their menstruation pattern with associated symptoms, as we mentioned before, then we can clinically confirm that they are going through menopause. However, there are more accurate tests that we can do to confirm menopause, for example, a blood test to check their follicular stimulating hormones. Menopause is definitely not a disease. It's a normal physiological state when women go through when their age goes up. However, women may experiencing some disturbing physical or psychological symptoms they often overlooked and is usually underdiagnosed. Treatment for menopausal symptoms are broadly categorized into two, so it's hormonal replacement therapy or non-hormonal therapy. HRT is effective in relieving most menopausal symptoms, including hot flushes, joint pains, mood swings, and vaginal dryness. Besides, HRT is associated with benefits in preventing some chronic diseases, such as osteoporosis and heart and blood vessels diseases, especially in those with premature menopause, that is, when women's periods stop before the age of 40. Theoretically, every medication comes with a potential side effect. So for the hormonal replacement therapy, it can cause some mild side effects, for example, like nausea, and there can be some normal vaginal bleeding, to a severe form of side effect, for example, blood clots in the legs or in the blood vessels, or an increase in risk of some sort of cancer, for example, breast cancer or uterus cancer. So if women consider to have some treatment for their menopausal symptoms, for example, the hormonal replacement therapy, then I would encourage them to speak to their GP or their gynecologist for more details regarding the side effects. For women who's going through menopause, it's a great opportunity for them to have a comprehensive health check, including a breast examination as well as a cervical examination with their GP. Also, I would encourage them to have an active lifestyle, have a good communication with their friends and family in order to smooth and streamline this transitional period during their menopause.